the moment is, again, when I've again been researching, it's one of the other aspects I've found that people advocate for the robotic, the true sort of robotic stuff is they're saying you're removing less bone and therefore, kind of revision surgery is easier. But again, I understand that with the conformal systematics that you mentioned and the patients, again, that's also you're removing less bone.
Preserving.
Made and all of those things. So kind of, it's almost it's matching out that argument, it seems.
So any time that you do joint replacement surgery, the sensible surgeon is always thinking about the next potential step. If someone has a knee replacement or a hip replacement, if they're below the age of 60, for example, you need to be thinking, well, maybe even with my best attempts, this patient's knee replacement may not outlive them. It may wear out, fail, or loosen at some stage in their life. And subsequent surgery, one of the biggest difficulties of dealing with redo or revision surgery is dealing with the amount of bone loss. Once you've lost bone, you can't regain it very easily. So it makes your challenges much more significant if you have to do redo surgery. So yes, preserving bone is a major issue. That's the same reason why I'm an advocate of partial knee replacement surgery in patients where it is indicated, because you're preserving as much of the joint as possible. Yes, the patient is in pain and needs joint replacement surgery, but if their arthritis is only localized to one small area and you can just replace that small area, not the whole knee joint, well, you've retained as much of their joint and their soft tissues and their ligaments, which for the future is going to be a beneficial thing.
Is there sometimes a difficult line to draw though, in terms of if, let's say, for example, somebody who's got, lateral compartment disease, but you can see the medial compartment is not great, it's not symptomatic maybe yet, but there's some signs of wear and tear. Is there sometimes a difficult decision to be made of, do you stick with the partial, or do you think, what, they're going to be back in a few years' time wanting that medial side done, so then you have to go?
It is a difficult decision sometimes. That's why it's so important to engage with the patient as well. If there's one thing that I'd like to believe that people feel that they get from me as a surgeon when they come to see me, is that I want to engage with my patient. It's a two-way communication to outline the pros and cons of the different treatment options, and then we come to a decision. I'll say to a patient, look, if you're interested in having a well-tried and tested operation for your arthritic knee, and you don't want to think that you're going to need to have redo surgery in 10 years time, then even though you might be suitable for a partial knee replacement now, maybe you want to think about a full knee replacement, which is maybe that little bit more reliable in the long term. But equally, if you are on the younger side, you have isolated arthritis in one area of the knee, and you have an expectation to return to a sporty, active lifestyle, I think that the well-performing partial knee replacement is a better option than the well-performing total knee replacement in that slightly younger, slightly more sporty individual. They are probably going to prefer that option, but it's a two-way communication.
Absolutely.